Good afternoon, Bermuda, and thank you to the members of the media for your attendance today. I begin today's press conference on a somber note, and on behalf of the government of Bermuda and the people of Bermuda, I express my condolences to the family and friends of the young lady who lost her life at the hands of a heartless murderer on Sunset Lane last evening in Pembroke during the early hours of this morning. It pained me to have to console another mother at the King Edward Memorial Hospital into the wee hours of the morning, along with Minister of National Security Renee Ming and Pastor Leroy Bean, as a result of such a horrifically violent act. I ask that all of Bermuda keep the family in their thoughts and prayers. And I would also ask all of Bermuda to please, if you know something, say something to help to bring the perpetrators of this incredibly violent and seemingly escalating crime matter to justice. Today, I am joined by the Minister of Health, the Honorable Kim Wilson, who will be first to give an update from her ministry, and then I will touch on general economic matters relating to tourism before I take questions from the media. Minister Wilson?
Thank you, Premier. Good afternoon, everyone. Today, there were 418 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda now has 181 total confirmed positive cases, and their status is as follows. 167 have fully recovered, and there are 5 active cases who are all under public health monitoring. None are in hospitalized, or in critical care, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 56, and the age range of all of our positive cases is from 9 to 101 years. Overall, 51% of cases were Black, 42% white, and 7% other or unknown. The source of all local cases is as follows. 70 are imported, 90 are local transmission with known contact, 21 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains sporadic cases. The 7-day average of our real-time reproduction number is less than 1. I will now like to provide you with an update regarding COVID-19 vaccine procurement, something which I'm sure is at the forefront of many people's minds. I can tell you that the government has recently engaged a contractual commitment to ensure guaranteed access for Bermuda to approved COVID-19 vaccines when they become available. Bermuda is supported by the Pan American Health Organization, or PAHO, which is a subsidiary of the World Health Organization, which is the specialized international health agency for the Americas. PAHO has collaborated with Gavi Alliance, an international organization whose mandate is to improve access to vaccines and to source COVID-19 vaccines for countries under the PAHO remit. This collaboration provides Bermuda with access to vaccines to support 20% of our population in the first instance, and additional access if and when required. The COVAX facility, which is managed by Gavi Alliance, is the mechanism through which demand and resources are pooled to support availability of and equitable access to the COVID-19 vaccine for all economies. The goals of the COVAX facility are as follows. 1, to develop a large and diverse, actively managed portfolio of COVID-19 vaccine candidates so that the best vaccines are ultimately made available and the supply will be sufficient for the highest priority populations. 2, deliver at least 2 billion doses of approved vaccines by the end of 2021. 3, guaranteed access to approved vaccines for every participating economy. And 4, end the acute phase of the pandemic by the end of 2021. The commitment to purchase the vaccines through the COVAX facility provides Bermuda with several advantages. Firstly, it provides us with guaranteed access to approved COVID-19 vaccines. Secondly, it means that Bermuda is able to capitalize on economies of scale with the bulk vaccine purchase of potentially 2 billion vaccines. And thirdly, Bermuda avoids the risk of trying to independently purchase vaccines, which could see challenges such as access, availability, and prohibitive costs, which could disadvantage Bermuda in the battle against this pandemic. In addition, the United Kingdom will be providing Bermuda with a proportional amount of vaccines. Therefore, with the two streams of vaccine access available to Bermuda, we are well placed and prepared to tackle COVID-19 with vaccines when they are approved and available. On a separate issue, as I mentioned earlier this afternoon, I can advise the public that returning officers and presiding officers employed by the parliamentary registrar, as well as all election candidates, will have the opportunity to undergo saliva testing prior to Thursday, the 1st of October's election, to help ensure voter safety during the COVID-19 pandemic. This means that the testing hours of PRA testing location will be extended tonight between 6 and 9 p.m. and tomorrow night also between the hours of 6 and 9 p.m. for those groups of individuals that I just spoke about to go and get a saliva testing. The government believes that this screening procedure will add an extra layer of protection for voters and provide further comfort to members of the public as they enter the polls on Thursday. For more information, individuals can contact the COVID hotline at 444-2498. I would like to now address a dangerous mistruth which appeared to be circulating locally on social media last week. I'm almost surprised that I have to make this statement, but mask wearing does not cause cancer. The CDC recommends that people wear cloth face coverings in public settings when around people outside of their household, especially when other physical distancing measures are difficult to maintain. The CDC director, Dr. Robert Redfield, said, and I quote, "Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, particularly when used universally within a community setting," end quote. International health organizations around the world agree that cloth face coverings are a critical tool to the fight against COVID-19 that could reduce the spread of the disease, preventing people who have COVID-19 from spreading the virus to others. Therefore, it is vitally important that we continue to wear our masks and to wear them right. Wear your mask so it comes all the way up, close to the bridge of your nose and all the way under your chin. And do your best to tighten the loops or ties so it is snug around your face without gaps. Always wash your hands before and after wearing a mask. Use the ties or the loops to put the mask on or to pull it off. Don't touch the front of the mask when you take it off. And for apartment or condo dwellers, put the mask on or remove it while inside your home, as elevators and stairways can be high contamination areas. A cloth face covering should be routinely washed depending on the frequency of its use. Please remember that masks are to be worn in most work environments as well. We at the Ministry of Health wear them every day. If you are in any doubt regarding the precautions or health measures that you should have in place at your workplace, I urge you to read the Return to Work Guidance for Business, which is posted at coronavirus.gov.bm. It includes sections on infection prevention and control measures, return to work considerations, occupational risk assessments, site cleaning and disinfection protocols, site operations and risk management, as well as general information on COVID-19. Additionally, it contains industry-specific guidance for healthcare professionals, care homes, offices and banking services, construction, mechanical and landscaping, warehouses, auto dealers and retail operations, with details such as PPE, such as masks, where it is appropriate and when to wear it as appropriate as per the workplace setting. Again, I invite you to look at the coronavirus.gov.bm for the return to work guidance. With our low COVID numbers, it is perhaps easy to forget that we are living in the midst of a pandemic, but the reality is that we are, and we need to take the same precautions that we always have to protect ourselves and our community. Wear your mask, wash your hands often, practice physical distancing, avoid large crowds, and stay home if you feel unwell. As I've said before, now is not the time for us to let our guard down. One of the reasons Bermuda has fared so well compared to other countries is because of our diligence when it comes to these actions. We have worked so hard and done so well. We must not stop now. These small steps will make all the greatest difference. And lastly, I would also like to clarify an incorrect story which appeared in last night's news cycle. A story ran claiming that the PGA group arriving in Bermuda at the end of October would be exempt from on island testing once they had received their arrival tests, as the players would be moving in their own social bubble. This is not correct. The players are not exempt from Bermuda's testing requirements. Players will take a pre departure test, arrival test, and day 4 test. Again, our stringent protocols have helped put Bermuda in a position which actually paved the way for such an event as the PGA to take place in Bermuda in the first place. So we must continue to apply the same regimes for all, which has proven to be fruitful to Bermuda as well as the organizations such as the PGA. Stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you, Premier.
Thank you, Minister of Health, for that comprehensive update. And it is important to note that we are still in the state of a public health emergency, and the coronavirus is still certainly a threat. I'd like to begin my comments today by speaking about certainly our new normal and Bermuda's position and outlook. And we can all remember that we began physical distancing in March, and through shelter in place and all of the other restrictions, Bermuda has been relatively successful in containing the impact of the coronavirus, which has now taken more than 1 million lives worldwide. As we sit here today in the last week in September, we are certainly at a different place. But we have been able to safely and securely allow more tourists to arrive to help stimulate our economy, and we continue to ensure that we have testing available throughout the country. Our public health strategy is to continually assess the results of these tests, conduct contact tracing when a person tests positive, and to require the best behavior that science and common sense requires. And so, Bermudians and residents should continue to be proud of the collective effort and discipline that has largely kept COVID-19 at bay. I say at bay because we have not eradicated it. Nonetheless, we have not reached community transmission. Whenever there is a new infection, public health officers quickly identify the flight the person arrived on and identify everyone that individual may have been in contact. And that is why it is critical that everyone who visits restaurants or other public places accurately completes the contact tracing information. I truly wish that we did not have to remind people, but the precautions that are in place will help to protect vulnerable members of our society in case of any outbreak. Now, I know that it is tedious, and I know that as time goes on with the small amounts of cases, people think that that is no longer necessary. One thing that I will say as a minister responsible for technology and government, we are trying to make that process easier. And 2 young men from our coding boot camp that we hosted early this year were engaged to complete an app that will simply allow restaurants or other establishments, liquor license establishments, to scan the driver's licenses of persons who are coming in to record their information. And this will make the entry of information a little bit simpler. This app itself has been demonstrated, and we're going to make sure that it goes through the privacy commissioner so it meets all necessary privacy requirements. And the information that is scanned is not going to be available to the restaurant, but it is only going to be activated by the public health authorities if that is necessary. Additionally, you would have heard earlier we spoke about our tests with COVID Watch out of Stanford University, and I know that that is now being piloted, and you would have seen notices on the government of Bermuda's social media platforms asking for people to respond to surveys on whether or not they would be wanting to use the Bluetooth contact tracing technology that is inherent in the COVID Watch app. Earlier this summer, as part of Bermuda's COVID-19 response strategy, the cabinet made the decision to purchase and introduce quarantine bracelets. The system is comprised of electronic bracelets purchased from a company in Hong Kong that is affiliated with the Hong Kong government, and the Aqua app developed by Hub Culture, a Bermuda-based international business. To properly implement this initiative, we hired 8 persons providing jobs for 8 young Bermudians who were not working prior to us introducing this quarantine monitoring solution. They are being led by Superintendent James Howard from the Bermuda Police Service and Major Wayne Smith from the FinTech Business Unit, and are called the Aqua Monitoring Team. The bracelet is paired with a smartphone and it uses Bluetooth technology and GPS to show the user's location and allows the team to see violations of quarantine rules. The initiative began on Monday, August 31st, and the decision was made to place bracelets on anyone who arrived in Bermuda without a negative COVID-19 pretest. Working closely with the Ministry of Health, the Aqua monitoring team ensures that everyone who was in quarantine complied with the rules and stayed home until they completed their quarantine period, obtained a second negative COVID-19 test, and were cleared to end their quarantine by the Ministry of Health. Today, 521 persons have been assigned bracelets, and as of Tuesday, September 29th, 160 persons continue to be actively monitored. The program is doing well, and it is now being expanded by the vendor to Hawaii. This was the intent of the government of Bermuda's overall technology strategy, that companies would test ideas in Bermuda's ecosystem and once achieving proof of concept, be able to market them in larger jurisdictions throughout the world. I am delighted to see this aspect of the government's technology vision realized, especially as it relates to the coronavirus. Hub Culture, a Bermuda company, introduced this solution to Bermuda, and now that the world knows how it works, they will market it to the global marketplace. As part of this deal, Bermuda gets a rebate on all bracelets purchased after our initial order, including any future bracelets that we purchase, as well as bracelets that are purchased by other jurisdictions, such as Hawaii. Bermuda has proved itself to be a global leader, and this solution is helping to make sure we protect persons and persons can enforce their quarantine. And that is vital to ensure that our economy can continue to remain open. And so it's key to note that though this contract was signed, as it is successfully demonstrated and as it is used in other jurisdictions, the Bermuda government will actually get money back from this. So this is certainly a win-win situation. Moving to tourism, I'd like to discuss the Fairmont Southampton's closure and the impact it has on Bermudian employees. I believe that having a large number of redundancies, in fact, that is a technical term because it's having a large number of persons who will no longer be working, is one of the biggest challenges facing any government. And in a year of multiple and severe challenges, we will listen, plan, execute, and also overcome on this one. The Bermudians who were employed there are homeowners, mothers, fathers, bill payers, and taxpayers who have made a career serving people, service with pride. For them and their families, we cannot allow the uncertainty of employment income to become the certainty of poverty. The Minister of Labor ensured the collective agreement was adhered to, and the Bermuda Industrial Union stated the hotel complied with the provisions. While that is admirable, following the terms of a contract, it is the legal requirement. That does not mean the staff are comfortable or secure about their futures. Having spoken with my colleagues and technical officers, between now and the reopening, there are ways that Bermudians can act and react to the closure. The renovation is a construction project, and we know that the hotel was purchased in December 2019 and was slated to close on January 2nd of 2020 for that renovation. The closure, of course, has happened earlier due to the coronavirus. But during the construction phase and in regular time, there are several hotel workers who supplement their income during the off-season by doing masonry, carpentry, or general labor tasks. They can and should enhance their skills and perhaps attain full-time employment at the site for the renovations. Those who are already in the construction industry will have an advantage on experience and skill set, but a project this large will require many workers with varying levels of experience. As such, I recommend those interested should contact the Bermuda College and or the Department of Workforce Development to determine if and relevant trades are being taught, or apprenticeships being offered, and make themselves available for their opportunities. To ensure that all former Fairmont Southampton Princess staff have the ability to secure reemployment, I wish to advise hotel owners and those that are in hospitality employers that given both the impact of COVID-19 on the industry and the hotel's closure, all 2020 and 2021 work permit applications in the hospitality sector will be heavily scrutinized to ensure Bermudian hotel workers, particularly those with the experience delivering Bermuda's tourism products, are employed first. This government will stand by the workers at the Fairmont Southampton. Thank you very much. The government acknowledges the proposed $100 million investment, and it is essential that Bermudian employees be the primary beneficiaries during the renovation and once the hotel reopens. It is said that luck is when preparation meets opportunity. I implore Bermudians impacted by the closure to do the things that may make themselves lucky. Moving on to more items regarding tourism. In terms of arrivals and air capacity, we are safely welcoming more visitors, but we are still well below our airline capacity, and in October we'll be operating at only about 36% capacity. In July, we had 5,438 available seats. That doubled in August to 12,122, and we're anticipating approximately 17,000 seat capacity in October. And while that figure is the highest since March, it is still 64% below our October 2019 seat capacity. However, there is progress that is being made that gives us further confidence that both our actions to battle the coronavirus and how effectively we communicate those actions to international markets. We do have new flights that are going to be launching service to Bermuda in October. Delta Airlines will fly JFK Airport 3 times a week on Mondays, Fridays, and Saturdays. American Airlines will fly to Miami 3 times per week. One flight will depart on Fridays, another will depart on Sundays, and the third flight will depart on Monday. And British Airways, which is currently operating 3 times a week, will fly 5 times a week by the end of October. And I have been told that the British Airways flight is operating certainly at high capacity, which is likely the reason why this has been increased. And that is due to the benefit of the excellent management of the pandemic, and also tourists from the United Kingdom who do come to Bermuda are not required to quarantine back in the United Kingdom on their way home. Sticking with British Airways, earlier today it was announced that from the 28th of March 2021, British Airways will serve Bermuda from London Heathrow and no longer Gatwick Airport. Business groups and the Bermuda Tourism Authority are in full support, as Heathrow is a far more dynamic hub for onward connection to major European cities, allowing Bermuda to create connections in secondary European gateways. And it is predicted that this will help our tourism recover quicker from European markets and certainly expand it as if it were compared to the flight at Gatwick. I am proud that our COVID-19 protocols to date have been effective and we've been creating global confidence in Bermuda and our ability to successfully manage the risks to residents and visitors. The fact that the Work from Bermuda program has been so well received with close to 400 applications also attests the balance we have struck between caution and commerce and between protecting lives and supporting livelihoods. Now I will move on to the provisions for public school students for the rest of the week. I'm sure that by now, everyone, especially people who might happen to watch YouTube, know that we are having a general election on Thursday. And as a result, all public schools are closed as they will serve as polling stations. Initially, some parents may have heard that schools were going to be closed on Friday as well, as that was the initial position. However, the ministry revisited that decision in light of the 3 days lost to Hurricanes Paulette and Teddy, the deep desire of teachers to capitalize on the return to face-to-face teaching and to assist students to normalize the new teaching and classroom protocols. The decision was also taken bearing in mind the disruption to parents' workdays every time a student has time off of school. Accordingly, schools will reopen as normal on Friday morning. I wish to reassure parents, guardians, and the entire student population of one more vital element of schools and their use as polling stations. Every school is scheduled to be deeply cleaned and sanitized before school reopens on Friday. All cleaning will be undertaken according to stringent protocols using approved products. And for the work they're executing to keep our children safe, we are grateful for the teams of custodians and cleaners who are committed to ensuring our students are taught in COVID-free environments. You have the government's and parents' support, respect, and admiration. Before I end, I would like to briefly address the concerns expressed earlier this week by persons, or a source, as I will call it, from the Bermuda Fire and Rescue Service. In July, the Minister of National Security, Renee Ming, and I met with the Fire Services Association's new leadership team. The team consisted of Mr. Nakia Pearson, Mr. Ryan De Silva, Mr. Anthony O'Brien, and Mr. Randy Elgurizma. During that meeting, the team briefed the minister and myself on a number of operational matters, including emergency response in the pandemic. Also, they relayed a number of concerns. After listening intently, at that very meeting, I confirmed to the Bermuda Fire and Rescue Service representatives that the breathing apparatus was given cabinet approval earlier in the year and has now arrived on island. I also directed that the capital funds that they were informed that were frozen be unfrozen so that the other equipment purchases that they were advised would put on hold would proceed. I also confirmed with them at that very meeting that the training that they said was also going to be put on hold was authorized to proceed. And we did our best to make sure that we alleviated the concerns at that time. And there was concerns regarding training, as there were new officers who had not been exposed to this training, which meant that they could not fully participate in the activities of the Bermuda Fire and Rescue Service. The government has the utmost respect and appreciation for the members of the Bermuda Fire and Rescue Service. They are my family, they are my friends, and they are all of our colleagues' families and friends as well. We recognize their commitment and dedication to the safety of the people of Bermuda, and their exemplary service during this pandemic and the recent hurricanes is commendable and speaks volumes to the level of professionalism and support that these fine men and women give to Bermuda. It is unfortunate that this issue became politicized in the daily newspaper, but such is the season of which we are in. I hope, however, that after Thursday, we can move forward in a spirit of collaboration. With that, I'm happy to take questions from reporters.
Premier, we'll start with Bermuda Broadcasting Company.
Don Burgess, Bermuda Broadcasting. Mr. Premier, you mentioned with the tracking watch, we're going to get a portion of the sales coming back. Can you say how much that is? And realizing the number might be small, but hope to make up.
Kind of, you're going to test my memory here. I know that the contract in size was less than 100,000 in total. It was the services to set it up, and also the purchase of the consumables, certainly. So you're certainly racking my brain. I do know that that clearly is a massive savings from having quarantine facilities. We know how much quarantine facilities cost. I will get the details back to you. I know that there was a credit on what it is we've done, but the way the contract was structured was that we could basically recoup our entire initial investment depending on how successful the product was. So, for instance, we know that United Kingdom is having issues enforcing quarantine, and other places are having issues enforcing quarantine. So, if it is sold into large markets, we could certainly see that we could see ourselves get to a place where our initial investment is completely reversed. And so we would have essentially served as the test location and gotten the services for free.
All right. Thank you very much. Health Minister, I want to revisit my question from 2 weeks ago about flus and the flu vaccine and helping with coronavirus. And perhaps I didn't phrase it as eloquently as I could have, but how could this year's flu vaccine be more important in helping provide immunity to people in this environment of having the coronavirus?
Dawn, as we've seen in other jurisdictions, the flu, particularly in the southern hemisphere, there have been episodes of flu, but we're noticing that there are less cases of the flu, principally because of the wearing of masks. So hopefully by the time we see more instances of flu, probably within the next couple of weeks, which is the beginning of our flu season, that we likewise in Bermuda will have similar experiences as we've seen in the southern hemisphere. Because of our mask wearing, there's less incidence of flu. However, to your question, with respect to getting the flu vaccine, which we are encouraging, as we've always done, everyone to get, because that will assist greatly in reducing some of the other side effects that are part of COVID. We know that there's a number of symptoms of COVID that are very analogous with the flu. So obviously, if you're having a flu shot, which again, we are strongly encouraging people to do, it will assist with respect to the recovery and the other symptoms, because what we don't want is somebody to unfortunately come down with both COVID and the flu. So because we already have a vaccine to guard against the flu, we were strongly encouraging members of the public, when that vaccine does become available, which we're anticipating in the next couple of weeks, to get their flu shot.
Thank you. One question that I've seen parents concerned about, Halloween's coming up in October, and they're wondering what the government's position is on trick-or-treating, because they don't necessarily want to go out and purchase Halloween costumes if it's not going to be allowed, or people going out and buying candy for trick-or-treaters coming to their house.
I can answer that in two ways. One is, obviously, we're not trying to encourage a lot of people to consume mass quantities of sugar. However, we are still encouraging, because we are still in the midst of a pandemic. And I appreciate that, that's a very exciting time for children. However, knocking on people's doors and going to houses that outside of your bubble is certainly dangerous, particularly in the midst of a pandemic. Perhaps families might do something like have their own little party with their intimate bubble, in their home. I mean, there's other things that we can do. There's a host of options. Bermuda is not going to be the only country in the world that's not going to be able to widely celebrate trick-or-treating. However, again, we are still in the midst of a pandemic, and I'm certain that the schools will probably have some type of, facility to help the younger children to be able to participate in trick-or-treating. But the reality is we're still in a pandemic, and I keep repeating myself, but unfortunately that is our reality. So there'll be other things that we've been accustomed to. Our new normal is the wearing of the mask, the physical distancing, which would largely preclude persons from knocking on strangers' doors for the sake of getting candy.
Okay, I'll miss the premiere this year then.
Yes, exactly. We'll be very disappointed.
Yeah. My last question for tonight, probably, and it's a long one, so please bear with me. SARS-CoV-2 is the virus that infects humans. This novel coronavirus causes the disease known as COVID-19. All around the world, we see people suffering from the terrible effects of COVID-19 long after they have overcome the infectious virus. Bermuda Broadcasting understands that there are still Bermuda residents in hospital after catching the virus and developing the disease who remain at King Edward many months after they were first admitted. They have not yet fully recovered from the effects of the disease. However, daily government COVID-19 stats do not reflect these continued hospitalizations. At the moment, according to the stats, no one is apparently in hospital. Why are you not listing people who got sick from COVID-19 and who continue to suffer from the disease and who still remain in the hospital?
That's a very good question, and let me explain it in a couple of ways. First and foremost, once a person has tested positive for COVID-19, following a series of negative tests, then they are deemed to be free of COVID. We've spoken previously about the fact that because the disease greatly adversely affects persons that have chronic conditions, persons that already have pre-existing serious conditions, underlying conditions, and they're the ones that are the most vulnerable, which is one of the reasons that we're always trying to encourage people to shield vulnerable persons as well as our elderly. So persons that have tested out, so to speak, of COVID-19, so they're no longer symptomatic or they're no longer displaying any of the particles, so to speak, of COVID in their system, may very well still have the pre-existing conditions which landed them in hospital in the first place. You'll note that the hospital, and I spoke about this several months ago, the hospital started maybe in April, I don't remember the exact date, testing all admissions. So upon admission, if a person tests positive for COVID, and that allows for the hospital directors to do the proper isolation, utilizing PPE and the like. But the majority of persons that have contracted COVID have pre-existing conditions. They already have chronic diseases, and it's the chronic disease which may place them continuously in the hospital, because our records are correct and it's accurate to report that there are no persons with COVID-19 in hospital or in critical care in the hospital or in the ICU units. Whether persons are still admitted in hospital where they previously had COVID and now they have tested negative, they're no longer deemed to have COVID. The incubation period is 14 days, and I believe after a second 14 days, if they have tested negative, then they're no longer deemed to have COVID. But they may still have other pre-existing conditions that have landed them in the hospital, and that's why they're still in admission.
Do you know how many of these long haulers are still in the hospital?
I don't have that information now.
Could I have that tomorrow when you have a chance to do the research?
I can't promise it'll be tomorrow, but I will undertake to have that information. But what I can say of major importance is the fact that there are no persons in hospital or in critical care from COVID.
Okay, thank you very much.
Okay.
Premier, what was that?
Good afternoon, and thank you very much. Fiona McWhirter from the Royal Gazette. Minister of Health, you asked people earlier to remember to wear their masks and explained again how they should be worn. Are we seeing a reduction in people adhering to mask wearing, do you think?
If you look at the indicators that we have on the website that shows the opening indicators, and they just show the performance of Bermuda generally, unfortunately in the red zone, we are still in the red zone as it relates to physical distancing and mask wearing. We have not come out of the red zone. We've seen peaks. We have seen peaks where we've come to amber, but it's shortly lived. And we are seeing, unfortunately, an increase in persons that are not utilizing their mask. We still encourage persons to log on to the Health IQ app, because that will allow them to log in their own observations of mask wearing. But I was looking at that on Monday, actually, the indicators, and we're still in the red zone with respect to mask wearing. And I think principally that's because people think that COVID is gone, because we're not hearing of, hundreds of persons that have contracted COVID and deaths and all the other things that we read about in other societies. People think that it's not here, and it still is here. It's prevalent.
Thank you very much.
Mm-hmm.
And with regards to the saliva testing that's on offer this evening, I think tomorrow evening as well, could that maybe set a way forward for screening in other situations?
That is a very, very good question, and I hear that regularly, particularly from the Premier. This is for screening, not for surveillance. The reason we haven't rolled out the saliva testing yet for surveillance is because we need to validate it. And we are in an enviable position for some, because we don't have a lot of positives. In order for us to be able to properly validate it, we need to run it with persons that are positive. So we are working on it. We are probably about halfway there with respect to the validation process. But again, it's because of the limited amount of positives, simply because we are requiring anybody that comes to Bermuda that is not a resident to have, anybody that comes to Bermuda has to have a pretest.
Thank you very much. And Mr. Premier, you mentioned some of the concerns with regards to the fire and rescue service. We did hear that breathing apparatus recently arrived on island, and I understand that the ladder truck that was purchased was delayed by COVID-19. Any indication of when that might be on island?
No, I do not have an answer to that question. I don't know, but I'm certain that if you send a follow-up inquiry, the good team at the Department of Communications, who continues to do excellent work, will be happy to get back to you on that one.
I appreciate it. That's everything. Thank you very much.
Thank you. Before I close, I do want to say, related to that, I know there'll be a press release out later, but pleased to announce that the Bermuda Police Association have voted to accept the government's austerity measures. And I want to express my thanks to the members of the Bermuda Police Service who did take this step into sharing the sacrifice of which is necessary during this time. And we have persons who are unemployed, and to make sure the government has the ability and funds to provide for those in this period until as we move forward. So with that, I will close by saying this. Thursday is election day, and I hope that you will allow me the opportunity to brief you next week, Tuesday, as your premier. So with that, thank you and good night, Bermuda.